Bismillahirrahmanirrahim. Today our topic is histology of blood vessels. First, we take the introduction of blood vessels. Blood vessels deliver nutrients, oxygen, and hormones to the cells of the body and remove metabolic waste products and carbon dioxide from them through blood. Exchange of these substances take place at the capillary level. Now we come to the types of blood vessels. Histologically, there are 5 main types of blood vessels. First one is the arteries, which are further divided into large size or elastic artery, and second is the medium size or muscular artery. Next blood vessel is the arterioles, then capillaries. Here capillaries are also of 3 types: continuous capillary, fenestrated capillary, and third one is the sinusoidal capillary. Fourth blood vessel is the venules, and fifth one is the veins, which are also of 2 types: medium sized vein and the large sized vein. Now we come to the structure of blood vessels. As we know, all the blood vessels have the same basic structure, and they have 3 coats or tunics, which are tunica intima, tunica media, and tunica adventitia. We see that tunica intima is composed of lining endothelium, which is simple squamous epithelium, and subendothelial connective tissue. Second, tunica media. This layer is made up of smooth muscles and connective tissue. This is. And the outer one is the tunica adventitia, which is made up of fibroelastic connective tissue. This is magnified picture of the general structure of a blood vessels: tunica intima, tunica media, and outer one is the tunica adventitia. Now we take one by one. First, arteries. General feature of the arteries: these are thick-walled blood vessels whose function is to carry blood from heart to the capillaries. These arteries divide repeatedly like a branch of a tree, and they become smaller in size. Their luminal surface is increased many times, about 800-fold, as compared to that of a large artery, that is aorta. And this pattern causes a decrease in rate of blood flow, which facilitates exchange of substances through capillaries. Structure of the arteries. Arteries are subdivided into following types that are based on the structure and size. First one is the large size artery, which is also called elastic artery or conducting artery. Example is aorta and its branches. Its function is to conduct blood from the heart. Thickness of the wall is about 1/10 of the luminal diameter. It can vary. Presence of elastic fiber in the wall allows it to expand during contraction of the heart and allow to recoil during relaxation of the heart, that is during diastole. And this maintains necessary blood pressure and thus permits blood to flow more evenly through the other arterial channels. This is the structure of an artery. General structure: tunica intima, tunica media, and then tunica adventitia. Now we take the layers of large arteries. Innermost is the tunica intima, which is about 100 micrometer thick. And this contains endothelium with subendothelial connective tissue. The subendothelium contains fibrocytes, macrophages, and smooth muscle-like cells called myointimal cells. And the fibers are collagen and elastic, and they are longitudinally arranged. Tunica intima is demarcated from the tunica media by a poorly defined fenestrated internal elastic lamina. This is tunica intima, this is tunica media, in between them is the internal elastic lamina. Now we take the tunica media. It is mainly made up of 40 to 70 layers of fenestrated elastic laminae arranged circularly. That is why it's called elastic artery. And between these elastic laminae, there are smooth muscle cells and collagen fibers. Then comes outermost elastic lamina, which is called external elastic lamina, and it is thick. Outside the external elastic lamina is tunica adventitia, the outer layer. It is composed of fibroelastic connective tissue and carries small blood vessels which are called vasa vasorum, and it also contains unmyelinated sympathetic nerve fibers. Now we see the changes in large arteries due to age. There is thickening of tunica intima due to migration and proliferation of smooth muscle cells from tunica media. Then tunica intima becomes 1/6 of the total wall thickness. Second change is accumulation of lipid in the myointimal cells and macrophages. Next is the formation of fibrofatty plaques in tunica intima, that is called atheroma. And the last one is the calcification of the tunica media. The atherosclerosis, which is gradual narrowing of the arterial lumen. Atherosclerosis is a killer disease more common in men. It not only affects the large artery, but also the coronary and cerebral arteries and cause arterial insufficiency, which leads to infarction or stroke. Then tunica media may undergo atrophy, resulting in loss of elasticity of the wall. And the last one is when the wall gets stretched, it forms aneurysm, and rupture of aneurysm may cause death. Now we come to the medium-sized muscular or distributing artery. Branches, these are the examples, branches of external carotid artery, radial artery, ulnar artery. Their function is to distribute blood to various parts of the body. The thickness of its wall is about 1/4 of the luminal diameter. Presence of smooth muscle. Presence of smooth muscle in its wall helps to control flow and pressure of blood through vasoconstriction or vasodilatation. Now we come to the layers of its wall. The innermost is the tunica intima. We were talking about the three layers of the wall of the medium-sized artery. The innermost is the tunica intima, which is made up of endothelium and internal elastic lamina. Here, no subendothelium. The internal elastic lamina is a bright refractile membrane thrown into wavy folds due to contraction of the smooth muscles in the media. These wavy folds are of internal elastic lamina. Then comes the tunica media. It consists of mainly smooth muscle cells arranged circularly, about 40 layers. Hence, its name is muscular artery. This tunica media also contains elastic fibers and few collagen fibers, which are intermixed with the smooth muscle cells. This is large power slide of the medium-sized or muscular artery. This is tunica intima, tunica media. It is thick in size, and outer one is the tunica adventitia. Tunica adventitia of the medium-sized artery. The inner part of the tunica adventitia contains more elastic than collagen fibers, and it also includes external elastic lamina. We take the middle part of this tunica adventitia that contains collagen and elastic fibers that run longitudinally. The outer part of this tunica adventitia is made up of loose connective tissue that merge with the surrounding areolar tissue and contains vasa vasorum and unmyelinated sympathetic nerve fibers. Then comes arteriole. The general features of arterioles: it is a small artery having a diameter less than 0.5 millimeter. It has thick wall relative to the size of its small circular lumen. The terminal branches of the arteriole are called metarterioles. They have smaller lumen and only few smooth muscle cells. Here is the metarteriole. This smooth muscle acts as pre-capillary sphincter that regulates the flow of blood through the capillary network depending on the metabolic need of the tissue. Now we see the structure of arteriole. It also has three layers. Innermost is the tunica intima. It is thin and it has only endothelial lining. It has neither subendothelial layer nor internal elastic lamina. The second one is the tunica media, which is made up of 1 to 5 layers of circularly arranged smooth muscle cells. Then tunica adventitia. This layer is thin and poorly developed. It contains a sympathetic vasomotor nerve fibers that bring about contraction of smooth muscles and thus control the size of the lumen. Now we see the capillaries, the general feature of the capillaries. Arterioles break up into small blood vessels called capillaries. These are the capillaries. These are referred to exchange vessels because they are involved in exchange of gases, nutrients, and metabolites between blood and the tissue. The tissues with high metabolic rates have abundant capillary network. For example, kidney, liver, and cardiac muscle. Now we see the structure of the capillaries. The lumen of a typical capillary is about 7 to 9 micrometer wide, which is almost equal to the diameter of an erythrocyte, and is lined by endothelial cells, which are 2 or 3 in number on cross section. If you see the cross section of the capillary, this is endothelial cell, and form tunica intima. This is tunica intima. The margin of the endothelial cells are held together by tight junction or gap junction. Numerous pinocytotic vesicles are seen in the cytoplasm. They are involved in transporting material across the endothelial lining in either direction. Parasites or adventitial cells are occasionally seen within the basement membrane of the endothelium, and it constitutes the tunica media of the capillaries. These cells contain contractile filaments in the cytoplasm and can transform into other cells. A thin layer of collagen fibers that surrounds the capillaries, it forms tunica adventitia. Now we see that the capillaries are divided into three types depending on the nature of the endothelium. First one is the continuous or somatic capillary. It is the commonest type of capillary present in the connective tissue, muscle, brain, lung. The endothelial cells form a continuous lining of the capillary. This is on cross section, and this picture is on longitudinal section. There is no gap between these endothelial cells. It is continuous lining. Second one is the fenestrated or visceral capillary. This is characterized by the presence of tiny pores in the endothelial cells. These pores are often closed by a thin diaphragm and allows dissolved substances and macromolecules to pass through it slowly. The permeability of fenestrated capillary is much greater than the continuous capillary. So these types of capillaries are found in tissues in which rapid exchange of substances occur between tissues and blood. For example, kidney, intestinal villi, and endocrine glands. This picture of his fenestrated capillary is on cross section. There is gap, pores between these endothelial cells. Here in longitudinal section, we can also see pores. Third one is the sinusoidal capillary. This type of capillary is found in liver and hemopoietic organs like red bone marrow and spleen. This type of capillary has a thin wall which is tortuous blood vessels and having large irregular lumen 30 to 40 micrometer. And this lumen is lined by discontinuous endothelium. Basal lamina is also discontinuous. There are gaps between endothelial cells that permit passage of blood cells and macromolecules. Here phagocytic cells may be seen in its wall, for example Kupffer cells in liver. This picture shows the sinusoidal capillary. This is on cross section. This is gap between endothelial cells and discontinuous basal lamina. This picture is a longitudinal section. Now we come to the venule. Venule receive blood from capillaries and have larger diameter, 0.5 to 1 millimeter, and its diameter is larger than the arterioles. Small venules that are also called post-capillary venules, these take part in exchange of metabolites between blood and tissue and permit leukocyte migration, as this occur in capillaries. Post-capillary venules in mucosa-associated lymphoid tissue, that is MALT, are lined by tall cuboidal endothelial cells and are called high endothelial venules. These venules are sensitive to inflammatory agents, and it results in leakage of fluid and defensive cells. Now we see the structure of the venule. The wall is thin with a large coalesced volume, and it is composed of 3 layers. Innermost tunica intima, which is composed of endothelium. Second is tunica media. It is composed of 1 or 2 layers of smooth muscle fibers. And the outer one is the tunica adventitia, which is thick and composed of connective tissue rich in collagen fibers. Now we come to the veins. The general feature of the veins are that these are thin-walled blood vessels that carry blood from capillaries to the heart. Large veins are formed by union of small veins, like tributaries of a river. They are often provided with valves which serve to prevent the reflux of blood. Now we see the structure of the veins. They are also subdivided into following types based on the size. First one is the medium-sized vein. Medium-sized vein differs from the medium-sized artery in having a collapsed lumen. The lumen of the medium-sized vein is collapsed. Second is thin wall with the tunica media containing fewer smooth muscle and less elastic fibers. Here no internal elastic lamina, and the fourth difference is presence of valves to prevent backflow of blood. This picture shows the medium-sized vein, endothelium, tunica media thin, and is a thick tunica adventitia. Now we see the tunica intima. It is made up of endothelium, and it is supported by a thin layer of subendothelium, and it does not have internal elastic lamina. If we see the tunica media, it is composed of few circularly arranged smooth muscle fibers which are embedded in connective tissue, predominantly made up of collagen fibers. Elastic fibers are few. Then outer layer, tunica adventitia, loose fibroelastic connective tissue which carries vasa vasorum and nerve fibers. This is high power picture of the medium-sized vein. Now we see the large size vein, for example, superior vena cava and inferior vena cava. It is made up of the following 3 layers: tunica intima, media, and adventitia. If we see the tunica intima, this layer is well developed. It is formed by endothelium with subendothelial connective tissue. Here is the endothelium, and below it's subendothelial connective tissue. Tunica media, it is either thin or absent. Here we don't see tunica media. Then comes tunica adventitia. It is well developed and is the thickest coat. It is made up of many longitudinal bundles of smooth muscle fibers. These are bundles of smooth muscle fibers on cross section. You have seen they are longitudinally arranged. And connective tissue is also present. This is large vein, superior vena cava or inferior vena cava, endothelium, and below endothelium, subendothelium. And then comes tunica adventitia, bundles of smooth muscle fibers, and connective tissue in between. Here is one MCQ. Medium-sized artery is characterized by the presence of, first option, a well-developed internal elastic lamina. Second, well-developed subendothelial connective tissue. Third is elastic fibers in the tunica media. And fourth one, smooth muscle fibers in tunica adventitia? The answer is A, a well-developed internal elastic lamina. Thank you.